This video is going to show you exercise options for patients following an adductor strain and is more geared towards patients in the later stages of rehab. Firstly, we're going to start off with a short lever adductor bridge, which requires the ability to have the upper body strength to hold a side plank. So you have to consider whether a patient can physically tolerate this position. The patient will have a bent knee resting on a stable surface. It's typically done on a weights bench, as this is a bit of cushioning. The aim is to hold this position for a set amount of seconds depending on the patient's tolerance to this exercise. We can take the bottom leg against gravity and do repetitions, so we're working on both legs. You can progress the exercise and apply the same concept to a long lever adductor bridge, which is going to be considerably more difficult. So as long as the patient can tolerate this exercise with minimal pain, it's a good progression to move on to. Resistance can be introduced at this stage with a band tied around a stable surface, one that's not going to move because the adductor muscles are quite a strong group. The patient can hold onto something as it's not a balance exercise. We want tension all the way through the exercise, so the patient is controlling the motion away from the body as well as the adduction component towards the body. Anywhere between a 12 to 20 rep max for a few sets is a good starting point. The exercise can be made harder by standing further away from the start point or increasing the strength of the band. Adductor slides are a good way to test if a patient is getting closer to a return to their chosen sport or activity. This is because an irritable tear won't like to be stretched. So it's essentially what the exercise is doing is stretching the muscle under tension, under load. The idea is for the patient to control the stretch on the way out. If there's any pain which is beyond acceptable limits at this stage, the patient can back off the slide and return to the starting point slowly. As time goes on, the exercise becomes easier and the patient can stretch a little bit further before any pain comes on, and it's a good marker for progress.